I just want to start off with a few stories, of broadband success stories from our region. If you've heard Rick Dees do his Top 40 radio show, it goes out to about 15 million listeners worldwide. When he is not based out of Los Angeles, he's based on his Boyd County farm in Kentucky, where he does his radio show while seeing his Angus cattle through the window. Boyd County is one of our Kentucky counties. Then there's Valerie Davis. Valerie Davis is a Kentucky resident who, like some of the stories you identified, suffers from MS and was not able to continue her work as a clerical person in the healthcare industry. And through a broadband connection, she has found a way to stay at home and better manage her condition and be with her preschool children while continuing to engage economically in her community. There's Martin County, Kentucky. Martin County is one of the stories from our local planning teams where they identified local needs and local solutions. The local health clinic was participating in our e-community leadership process and identified that they're interested in forming a telehealth unit there for the residents of Martin County. The local technical college said, we've been thinking about adding that to our curriculum. If you can establish that, we'll partner with you and provide training for our students at our technical school. Well, there's a mine operator who sat around this same table, and he said, if you can provide the unit and provide the leadership for it and get this telehealth unit and mobile health unit working, you can drive it up the hill to our mine and do health screenings for our workers. And that's exactly what they did. And the impact has been, one, the coal miners are finding a shorter path to a healthy life. They've been able to do early screenings. There are lots of success stories about more dire conditions that have been avoided. The mine operators' health insurance rates have gone down through the screening process. Well, the county judge executive, who's also on our e-community leadership team, was hearing these stories, and he decided to promote this as a value add to that community. So he is now adding telehealth as one of the value adds to attract more industry. These are stories that arise out of the model that Connected Nation implements through Kentucky and now Tennessee. And on a very high level, what we have is a simultaneous supply side enhancement program and a demand creation effort, demand creation and aggregation. On the supply side, we have identified that we're going to fill all the gaps where broadband doesn't exist, and to know where those gaps are, it requires a data collection process. So we have mapped the broadband deployment in Kentucky and now in Tennessee, and we're working now in West Virginia to do a similar kind of mapping initiative. If you're going to fill the gaps, you have to know where they are first, and you can't know where they are unless the providers tell you. So we have developed a cooperative mapping effort that involves all the broadband providers in the state, and they share with us as a nonprofit 501c3 organization their data, and we're able to map this in a way that helps inform policy and helps providers identify where they should best invest their next deployment dollars. Once we have this map created, we can overlay it with all kinds of different kinds of information, publicly available information. Census data, for example. Once we have a map of the deployment, we can overlay it with census information and identify clusters of unserved areas that can help spur deployment into those unserved areas. Also, we have this demand creation and aggregation process that involves forming these e-community leadership teams in every community in Kentucky. Kentucky, for example, has 120 counties, and in each county there's a local planning team that's comprised of representatives from 9 different sectors, K-12 and higher ed and healthcare and agriculture and tourism and libraries and local government. We basically drive to the local level this IT planning process from a private and public perspective. So all across the entire state, there are these local discussions going on, and taken together they've had the effect of increasing demand for broadband in the state by tune of 100%. When we started this program, it was announced in October 2004, when we started this program, Kentucky ranked near the bottom for technology adoption. And now our adoption rates have led the country. And we had a long way to go. But the 100% adoption rate has certainly provided an incentive for deployment into new areas. When we started this program, about 60% of Kentucky households could access broadband. As of today, that's 96%. We're on track to have 100% coverage by the end of this year. That's been an exciting development. And this deployment has happened through private investment. There's been north of $700 million of investment in the private, or from the private sector in the telecommunications infrastructure in our state. And that investment is what has been the key enabler of our deployment growth in our state. And we're in the process of putting some final touches on some research that defines the economic impact. It'll be available in about a month. But some of the things that we're already identifying is that as a result of broadband, Kentuckians are benefiting. On average, the average Kentucky broadband subscriber has saved $625. That ends up to be about, I think, $1 billion total, but I can't wrap my head around that big of a number. But I know that per prescriber, it's about $625. That's made a difference. There have been more than $800 million saved in avoided healthcare transactions. When you combine the number of trips to the emergency room that didn't happen, and the number of visits to the doctor's office that didn't happen, and the improvement of self-care that's been enabled by a broadband connection in the household, it's had a cumulative effect of being more than $800 million. These are big numbers, and they point to a big reality, and that is when a state has a comprehensive plan that attends to both supply side and demand side realities in a way that creates a space where everybody can find their place in the table, really good things can happen. So Connect the Nation is our national organization that's making these models and this kind of leadership available to other states as they come to us right now.